So you have a deviated nasal septum and your turbinates are large, and you've had other causes of nasal obstruction ruled out, such as sinus infections and nasal polyps, and you've done your saline and nasal steroids and still not happy with your nasal airway, and you and your ear, nose, and throat doctor have decided that you want to proceed with nasal septal reconstruction and reduction of the turbinate size, which we commonly refer to as having my septum fixed and doing some other stuff in there, because the turbinates kind of take second billing, but they're very important. So generally, the surgery is an incision here inside the nose, and then all the rest is done intranasally. So inside the nose, the incision is made, the sandwich that is the cartilage and bone and the mucous membrane is elevated so that bread is moved away and the meat is in the middle of the sandwich. The meat is what is straightened out. Usually bent cartilage is morselized so that we break its memory, and the bone is removed because it doesn't do well when you put it back there. The cartilage generally grafts back quite nicely. So the incision is made, the cartilage is either removed and morselized or scored to make it straighter, and the bony spurs are removed, and now you've got a straight cartilage and you can put the mucous membrane back on. Oftentimes a splint is used, so I think this is like forming concrete. You know, you want to have your plywood, you pour the concrete, but you got to have rebar, and the rebar is the strength of the union. So collagen is that, and collagen forms at about 7 days. So generally the splints are going to stay in for 10 to 14 days. The splints are sewn in with a single stitch. You come into the office, that stitch is removed, the splints are taken out, and you go on saline spray to heal any of the raw mucous membranes from the reduction of the turbinates and the septum as well. So what to expect after septum surgery? So you've had the septum surgery, you have the splints in. Now most splints have a tube that is welded to the side that's designed to help you breathe while you have the splints in. That can sometimes get a little clotted with mucus and stuff. So we have our patients breathe in saline and go ahead and spit out the nasty stuff over the sink. And we also have vasotrace or Vaseline to the nostrils to prevent the splint, which is made of a floppy plastic, from digging in too much right here. So that keeps all that area soothed. You'll have drips and drabs of blood for the first day or two, and so we generally have a mustache dressing, which is a little gauze that's rolled up just with a tape that goes across just like a mustache, just so you don't have to sit there and daub it all the time. And then the bleeding usually tapers off, and you can not use the mustache dressing. Elevating the head of the bed, particularly the first 4 days when swelling from surgery is at its highest, is helpful. You can put some ice over the bridge of the nose as well. And having a humidifier in your room at night when you're not able to wake up every hour and put the saline in is very helpful to keep everything moist. In 10 to 14 days, when things are going to be straight and remain straight with collagen formation, which occurs at about day 7, the splints are taken out in the office. The single stitch that has them connected is taken out, the splints are taken out, and then you continue your salt water to heal up the remainder of the surgical site. Good news, septoplasty and turbinoplasty is highly successful, about a 95% success rate in terms of producing an airway that people are happy with. And the complication rate is quite small. Perforation of the nasal septum, which is a hole in the septum that connects the left and right sides, is thankfully rare. And if it does occur, usually can be surgically repaired with another surgery. So that's exceedingly rare. Severe bleeding from the turbinates, 1 in several thousand, have to come back to the operating room for control of bleeding from the turbinates. That's usually not a complication that requires other surgery, just a bump in the road. So things you should be careful of. It's important not to blow your nose too hard for 2 to 3 weeks after surgery. You can change that mustache dressing as needed underneath your nose, and then when the bleeding tapers off in the first day or 2, you don't need that dressing anymore. There are no dietary restrictions. You shouldn't lift over 20 pounds because that can increase the pressure within blood vessels and cause bleeding. Now, you can shower and bathe as usual. I would just not take super steamy showers because steam can dilate the blood vessels and promote bleeding. So kind of a lukewarm shower rather than a steamy shower. You probably shouldn't swim for about a month because there's still some raw mucous membranes that can have bacteria from a public pool into them. So about a month is when we tell people to go back to swimming. You should also try to avoid a lot of aspirin and non-steroidal anti-inflammatories because they can have an antiplatelet effect and can promote bleeding as well. So when to call your doctor? If you've had your septum surgery and you've developed severe bleeding. Now a little bit of bleeding is not a big deal, but if you're having to sit over the sink and watch it drip, that's a time to go ahead and call your doctor. If you develop severe fever, any facial swelling with any redness, that's a sign that something's become infected. That's the time to call your doctor as well. If there's any severe swelling that is unexpected, that's a time to call your doctor, even if it's not associated with redness.